In India, 1 in 9 people are prone to cancer.
And it's the top cause of death among non-communicable diseases.
मगर क्या हम इस जानकारी से डरकर बैठ जाएं? नहीं.
This statistic is an opportunity to fight fear, to fight cancer with awareness.
We can win over cancer with advanced treatments, medications, and technology, especially when it is detected early.
And that's why it's important that you opt
For regular cancer screening.
And timely health checkups for early detection.
रेगुलर हेल्थ चेकअप से कैंसर जल्दी पकड़ में आ सकता है ताकि उसे बढ़ने से पहले ही रोका जा सके.
All we need to do is to take charge of our health.
So let's come together
And stand united
against cancer.
Namaste, Jai Hind, and welcome to this very special presentation on the News 18 network. I'm Anand Narsaman. We bring you a message that holds the power to save lives and change destinies. Welcome to Sanjeevani, a groundbreaking initiative by Federal Bank Hormis Memorial Foundation and the News 18 network, along with Tata Trusts, dedicated to promoting early detection of cancer through regular screening. As per studies, 95% lives can be saved through early detection of cancer. Sanjeevani, United Against Cancer, is not just a campaign. It's a movement to empower individuals to take control of their health and make them understand why timely screening is a must. Let's stand united against cancer, ensuring a brighter, healthier future for all. Together, we can make early detection a reality and save countless lives in the process. Let's start this season of Sanjeevani with a very special conversation between my colleague, Zaka Jacob, Managing Editor, CNN News 18, and Federal Bank CEO and MD, Mr. Shyam Srinivasan, who's our partner in taking this cancer awareness campaign to every corner of the country.
Shyam, thank you very much for joining us on this very special broadcast. So, in 2021, when the world saw the biggest pandemic ever, and at that time, Federal Bank joined hands with Network 18 to launch what was then India's most successful vaccination awareness drive, Sanjeevani. Tell us a little bit more about how that partnership came to be and how did it help in combating what was the toughest modern-day pandemic that we've seen?
The primary objective then was awareness, because there was this fear and reluctance, reticence to try and experiment with this whole vaccine as a solution for COVID to sort of prevention. When we knew that we reached lakhs of people in the many corners of the country and could go out and change lives, and I'm really glad that we chanced upon that.
So let's talk a little bit about preventive health. This year, Sanjeevani is back with a big focus on spreading awareness about health checkups, particularly in the early detection of cancer. Talk to our viewers about why you've chosen to focus this time around on cancer.
So when the teams, I think our team and the Network 18 team sat down to look at what are the various health issues that come up and which are the ones that are has both taboo, reluctance to test, and has far-reaching consequences of not testing, and more importantly, the number of incidences. And unfortunately, and not surprisingly, the whole area of cancer and prevention there seem to sort of jump out as the most prominent ones that needed advice, preventive support, and most importantly, awareness. Hopefully, over the coming weeks and months, we will be able to reach out to many parts of India where awareness levels are low, or even if they're aware, reluctance is low, and to share with them the importance of testing early and the benefits of doing so. Lives have changed. In the public domain, we see so many people who have fought it and come out, and they've always argued that if they knew it earlier, they could have dealt with it better. So I think we're inspired by the fact that the need is there. Consequences of testing early and preventive care is quite enormous.
And finally, was there any personal anecdote which served as an inspiration for this campaign, whether it was in your personal interactions or from one of your employees or one of your customers, which inspired this entire campaign on cancer awareness and cancer detection early?
We finally chose, I think there will be 4 particular more prominent cancer themes that we are going to be giving our best support to. See, like everywhere else, as a kind of large organization, when we socialize this thought, immediately some of our HR colleagues pointed out there were 3, 4 individuals who have had, unfortunately, bad outcomes. But there are some individuals who have fought it and have come out, and I've seen the sharing of what they went through by 2 of our colleagues. Actually, both husband and wife work in the bank. The lady went through is sort of recovering from a very tough phase, but they have publicly shared their journey of how they detected and how they have overcome and how they are raising a family through this. And that story is both motivating, inspiring, yet touching, and one wish that they never had to go through. Personally, a dear batchmate of mine, whom we met middle of last year in great health, just disappeared. Right, and all these are only pointing to the fact that if only we knew it earlier, could we have done better? And so I think the whole program that we are conceiving is, of course, stemming out of a lot of public data that is there, but also experiences that the bank or individuals in the bank have had, and their narration of it, and their experiences, that the fact that they're able to come out and fight it and live and be an example is inspiring. But the fact that they had to encounter this or endure this is rather unfortunate. So we are hoping that instances of that nature is what we should try to help and give reassurance to people that there is an ecosystem willing to wait and support. If only all of us could sort of give it attention and detect it early.
All right. Shyam Srinivasan, it's always a pleasure speaking with you. Thank you very much for joining us on this special broadcast.
Thank you, Zakar.
Thanks a lot, Mr. Srinivasan, for sharing your vision for this initiative. It is now time to meet a cancer fighter who faced his diagnosis with utmost resilience and positivity. This is the story of Rajneesh Singh, an HR consultant who remains fearless, hopeful, and even exuberant during his journey to recovery.
एक फौजी जवान की तरह जीना है, जो एक बार आगे बढ़ गया तो मुड़ के पीछे नहीं देखता. Hi, I'm Rajneesh Singh and I'm a cancer fighter. Colon cancer case, but yes, it went bad because it had started spreading. And so this was a stage 4 situation. For me, it became a battle. And so I went into that mode that this thing has to be taken head on. My closest family, yes, my wife, son, both very, very supportive, very positive. So that helped immensely. The family, the friends, they also play a big role. That's a very important support group. Just the night before I got admitted for my surgery, for some reason, I just thought whatever those 10 days had been of the tests, I thought of just writing them down. And then these 3 magic words came, the good patient, that I have been hugely cooperative, and whatever I have been told, like a very, sincere student, you've been just following the instructions. So that is where the names got stuck. And then I thought of doing this, I think, for the benefit of the larger cancer community, rather than keeping it under wraps. I just wanted to do it the other way around, talk about it, and let the world know that if you have the will, if you have the inner strength, you can fight it. As of now, things look absolutely in control, but yes, I need to stay watchful of any symptoms that crop up. No way I would allow the cancer to win, in the whole battle.
That was such an inspiring story. Rajneesh remains undaunted in the face of cancer. And as we conclude this launch show of Sanjeevani, United Against Cancer, we are reminded of the power of early cancer detection. The show has come to an end, but this mission, this movement has only just begun. It's not just about saving lives, it's about changing lives through regular screening and early detection. With knowledge and collective action, we can rewrite the narrative in the fight against cancer. Thank you for tuning in to Sanjeevani, United Against Cancer.